The session today is focused on helping families understand what happens as children with developmental disabilities transition into adulthood, particularly around legal issues, benefits, and living options. And we would very much like to thank Clinton Manor today for being our sponsor. Stay for that.
Hi, good morning, everyone. Thank you for the introduction, Chris. I'm with Clinton Manor. Sorry about that. So Clinton Manor Living Center is a skilled nursing home as well as an ICFDD for individuals with intellectual and developmental disabilities. We are located in New Baden, Illinois, so about just 20 minutes east of here. We've been around since 1988 under the same leadership and ownership. We are a 5-star rated nursing home, so I feel that we are the best of the best in the area. Our mission is that we passionately support each person in living a meaningful and satisfying life, and that's also with how we take care of our employees. We're very well known for our employee benefits, wellness initiatives. We feel that if we take care of our team members, they're able to take care of those individuals we support the best possible way. We also have a sister company called My Life, My Home. That is an operation of CILAs throughout St. Clair and Clinton County. We have 8 CILAs. Also under the same leadership and ownership. They have been around for about 25 years, and again, you know, we do an excellent job and we have very high standards. Whenever I go into our SIL homes, they're homes that I myself would be comfortable in living in. So, and as Clinton Manor was renovated recently last summer, and then hopefully our ICFDD, we're going to be renovating that in the near future. Does anyone have any quick questions? We'll let the experts over here get to.
So I'm going to jump in just so. Yeah. So my son lives at Clinton Manor. He's been there 13 years. So just as a FYI, as we start.
Yeah. We have a lot of longevity with the individuals we support, as well as our leadership. We have DSPs, we have CNAs, we have nurses who have all been with us for 20 plus years. So we keep a consistent crew there.
What's the cost per month? And can you get insurance to help with it at all?
You can get insurance to help with it. A lot of our individuals are being paid through Medicaid. Now, our skilled nursing home, that ranges daily rate anywhere from about $275 to, if it's a private room, like $400 a day. It really just bases on each person's insurance and situations. But we accept Medicare, Medicaid, and then private insurances and private pay.
Okay.
Yeah. All right. Well, you all have a lovely morning learning lots from these ladies.
Thanks, Samantha. Before we get into the meat of it, if you did not sign in on your way in, if you would please sign in on your way out. It's at the front desk, so we can keep track of how many people we have. So, today we're going to start with an overview of Social Security and disability benefits, followed by a conversation about living options and planning from the parent and guardian perspective. We'll also leave plenty of time at the end for questions on this. So we're going to start with introductions. If each of you briefly share your role and connection to supporting individuals with developmental disabilities. Rita, we'll start with you.
Well, I have my husband and I have a son, Mark, that lives at Murray Center. He's lived there for 30 years. He is profoundly disabled. He needs to be diapered, fed, changed. He needs total around-the-clock care, can't feed himself. He is happy. He is the most happy child. He can walk. He is free rein to walk the entire cottage. He's very, very happy. We've been very blessed. Many of his caregivers have been with him for 20-some years. I'm also guardian for another individual who lives at Murray who's even more profoundly medical than Mark is. I am also a guardian for someone that lives in one of the community-linked SILA homes. My brother had lived in one for 20 years. He passed away 2 years ago. We still go to that SILA every week because they are really family to us. They are excellent. We've been very, very pleased with them. I'm also on the board of Voice of Reason, which is a national organization for those with disabilities. I'm the president of the Murray Parents Association. We are very, very active, helping everyone at Murray. We buy many, many things for the center, and we advocate in Springfield. We are very well known by the legislators in Springfield, for better or worse. The governor's office knows us very well, for better or worse, and sometimes I think it's worse on their end, but we're very, very active politically just to make sure, and Murray is an ICFDD state-operated which you would think the money is just flowing in, but many of the things our parents group purchase because the state just isn't, like golf carts, TVs, clothes for individuals who come in. Whatever anybody needs, we make sure they get it one way or the other. So I just, I'm a retired third grade teacher, and the disability world is my life. And that's it. So there we go.
Carrie. So I'm Carrie Welchdahl. More than anything, I'm a mom. That the pandemic changed my life. It changed my son's life. He was living in Clinton Manor, and at no fault of theirs, obviously I wasn't allowed to see my son. So I started advocating to allow essential caregivers in. I got to see my son after 128 days, and that is one of the shortest you will hear of anybody. The average was 400. I got to see my son because he had to go back to the doctors. And even then, for the first few months, I had to socially distance and wasn't allowed to touch or hug or kiss my own child. And he's an adult, but he's still my kid. The difference between me and a lot of parents is, or a lot of families in general, that once they got in to see their loved ones, they just went back to normal life. By this point, I was done. I was not letting this ever happen again. We now have an essential caregiver law in the state of Illinois because I helped write it and worked with Senator Tracy and Representative Myers to get it passed. Because of that, I'm also trying to pass it with a group of people on a national level. I've joined a few groups doing some national long-term care reform. You know, why we put people in nursing homes here and people with developmental disabilities here, and then, you know, someone that needs assisted living here or memory there. Why are we not building community and making it, first of all, I would much rather live with my son, at least on the property where my son is, you know, because that's my family, his home. Clinton Manor is my home. I tell people that all the time. I refer to it as our home. So I'm working with a group of people that are trying to conceptualize and work with organizations to find out how to do this and stop segregating people, giving people options, which would also bring the cost down because we'd be sharing services and bringing, you know, who wouldn't benefit from a nurse being on site all the time, even if they don't need it. That's not the part you need, but they're there when you need them. And this can be done, and it can be done cheaper than what, you know, when Sam was talking about cost for the skilled nursing, I can tell you that for the ICFDDs, the two highest in the state of Illinois, and they rotate back and forth on a regular basis, is Clinton Manor and Bryan Center in Centralia. And their daily rate is pushing around the 700s. Because their acuity and a high level of residence is so high. But this could be done better. And that's what I would like to see. I also believe families are not educated. IDD parents are not educated. We are left to scrape and kick and figure it out on our own. And unlike most, I kick and scream a little louder.
Thank you, Carrie. And last but definitely not least, we have Tracy Douglas.
Hi, I'm Tracy. I work at Land of Lincoln Legal Aid. I'm in the public benefits unit. So we do all of the public benefits, federal, like Social Security and Medicare, but also state benefits like SNAP, TANF, Medicaid. We help when you have applied for a benefit and have been denied, or if you already have that benefit and you're being cut off. So that can happen with like Medicaid, Social Security is a big one. I also used to work in LA County in California at Vetsetic Legal Services, which is known for its elder law work. And I worked in a medical legal partnership with an LA County hospital and did a lot of advanced planning work. I did conservatorships, what in Illinois are called guardianships, with adults with developmental disabilities. There's a special kind of conservatorship for that, and I did some of the supported decision-making documents there, which is really interesting, and we will talk about later.
Okay, great. Thank you, Tracy. So we're going to start with Social Security and benefits overview. So Tracy, back to you. One of the biggest questions families have about Social Security is about Social Security and disability benefits. Could you walk us through the basics families should know when their child becomes an adult?
Yeah. So there's two Social Security disability benefits. SSDI, which is Social Security Disability Insurance. It is also called RSDI, Retirement Survivors Disability Insurance. SSI is Supplemental Security Income. SSDI is the one you pay into. So when you work a job and you are paying the Social Security tax, you are earning credits for retirement and disability. If you do not have a job that pays into SSDI for whatever reason, you're looking at SSI. So that's the difference. One is an entitlement that you've paid for. The other one is means tested and more like a welfare benefit. They use the same disability rules though. So when they decide if somebody is disabled, it uses the same 5-step process for deciding that. SSI you can be on as a child. There's no child disability benefit under SSDI. That happens when that person becomes an adult. That's called disabled adult child, or DAC. The parent, to get that benefit, the parent must be retired, on disability, or deceased. So in Social Security speak, just when you are deceased and on survivor benefits, that is called, well, that's survivor, sorry. And when you're on disability and you have a child, that is an auxiliary benefit. So you get paid a little bit of money because you have a child. But that doesn't depend on their disability. If you're working, though, and not yet on retirement or disability and have a child under 18, they can be on SSI as a child, and it has special rules for children. When they become an adult and they are on SSI, they do what they call redetermination, and they use the adult rules for deciding disability, which are different from the child rules. You can also apply for SSI as an adult, like if the parent is not yet retired, deceased, or on disability, you can get SSI as an adult. For DAC, the disability has to start before age 22. You don't have to apply before age 22, but that can be really hard if you're waiting many years to apply because you have to have evidence. Social Security doesn't just take your word that you have a disabling condition. They get your medical records and they make sure they are consistent. Another big difference is SSDI and retirement come with Medicare. On disability, you get Medicare after 2.5 years of being on SSDI. Many people get that almost automatically once they've won their disability case because going through the application, denial hearing process takes a long time. So when you finish that process, you're probably already been waiting 2.5 years, and your Medicare entitlement comes up pretty quickly. Medicare also, or DAC also gets Medicare. If the parent has enough credits for Medicare, the child will. It's not 100% of the parent's benefit. DAC is a percentage depending on if the parent is on disability or retirement or deceased. So it's not like you get $4,000 or $3,000 on retirement and your DAC child will also get that. It's less. If the child has a severe disability where they can't make decisions themselves, then they usually appoint what they call a representative payee. So the parent gets paid the benefit and has to spend it on behalf of the child.
Okay. So Tracy, what does the application process typically look like for a family?
SSI cannot be applied for online. You can submit your information. Social Security calls it a protective filing date. And then you have to call or be called by Social Security, and they finish the SSI application. SSDI you can apply online, but I think Survivor you can't. And there is currently a delay in getting that with the field offices. So both you have to file an application. The biggest mistake I see is people put their symptoms where they're describing, why are you disabled? They don't put their diagnosis. And Social Security needs the official medical terminology. Like if you just put back pain. But if you have a more specific condition, they're going to look at that because they depend on the medical evidence. Do you meet certain criteria? They need the specific terms. That's where a lot of people make a mistake. After you apply, it goes to a state agency called Disability Determination Services. They are the ones that actually make the disability decision. So they're going to request the medical records, look through them. They may send your child to what they call a consultative examiner, who is a doctor who's not your doctor. Although your doctor can actually do this, but most miss that paperwork and don't do it. After they have made the decision, yes, you're disabled, or no, that goes back to Social Security field office, and you'll get a notice from them that says, we reviewed your records and we decided you are disabled, or we reviewed your records and you're not disabled enough. Then you have appeal rights. There's 2 steps. And the third one, you get a hearing with an administrative law judge.
Can you talk a little more about shared decision making? So, for example, what if a child is their own guardian when you're trying to go through this process?
Good. What do you want?
Can you skip to the next one?
Sure.
Actually? Okay. So this is a new thing in a lot of states called supported decision making. It's specifically for adults with an intellectual disability or a developmental disability. It gives the person that we call the principal in supported decision making the decider. That's the adult child. They can select people that they want to help make decisions with them, but those people are not making the decision. They're just supporting the individual and advising them. Documents that actually the Illinois Guardianship Agency has a sample on their website for this. The documents outline what they want help with and how. Then it's really, really cool that this new season of The Pit, if anybody watches that, actually had an episode with this. I was so excited. One of the residents has a sister with autism, and that sister has supported decision-making documents.
So I'm going to add something that I just learned. So the PIT they wanted to make sure they did it right. So they reached out to Caring Across Generations, which is this very large family and caregiver organization. And they reached out and they had them consult with them through this to make sure they did it right.
Yeah.
Which is amazing because TV shows don't do that. Okay,
Yeah.
sorry.
It's really cool. So the difference with a power of attorney is, if you go back.
Yep. Wait.
Okay. A power of attorney gives your agent the power to make the decision for you. You're the principal, the person making the power of attorney, don't get to make the decision anymore once the power of attorney is effective. And that can be now or in the future, but it's the agents who are making the decision. In supported decision making, it is still the adult child who's making the decision. This outlines a bunch of stuff about powers of attorney, but there's several kinds, like a healthcare or a financial one. They are needed because courts look for the least restrictive means. So if you're thinking about maybe I need guardianship, which is a court process, if the individual who would be subject to the guardianship can instead do supported decision making or a power of attorney, the courts prefer that. So in California, I worked at a hospital, and the doctors would refer patients to us, and sometimes parents tell the doctors things that make the doctors think the child is more disabled than they are, that they cannot make healthcare decisions. And doctors are looking at, does a person understand the treatment, understand why they are here? That's different from legal capacity, which is, can you understand this document that I'm helping you do? So I would talk to the patient and then, learn, wait, this person could probably do supported decision making or power of attorney, and help them do that instead, because that is, we're trying to help them live on their own and be as independent as possible, and that's where these documents help out.
So I have a question. Does guardianship overrule power of attorney? So if you have guardianship, that means you also have power of attorney?
Yes.
Okay.
Could we talk a little about guardianship?
Yeah, from our perspective, go ahead and add your guardianship,
Okay.
and then the two of us.
You can skip ahead.
You want to go back to guardianship?
Yeah.
To guardianship.
Yeah. So guardianship is a court process.
Yes.
A state court process. You file for guardianship. You can get a temporary guardianship while you're going through the court process, because there are several steps you have to follow to get the permanent guardianship. But guardianship takes away the ward's civil rights. That the ward is the individual subject to the guardianship, and you as the parent would be the guardian. Typically, the parent is the one asking for a guardianship. So within the guardianship document, like, the court can decide this person can't vote anymore, the things that they can't do that are the guardian's decision now. So that's why we look for least restrictive means, because guardianship is not exactly an extreme solution, but it does take away a person's civil rights.
Now, in Illinois, though,
Sorry.
you do not get the person who has guardianship where they have a legal right to vote in Illinois. You can't take that away from them, because we have many people who live at Murray that vote. We have people who live,
Right.
they still can vote. Another thing in Illinois that you have is something called right to placement. If you do not have right to placement in your guardianship document, and you decide your child needs ICF services, the state can say, and ICF services are a federal right. You have a federal right to them if your loved one qualifies for that. But in the state of Illinois, if you do not have right to placement put in there, and that's all you really need to have in there is right to placement, they could say, no, you can't do that, because they consider ICFs institutions. And in Illinois, you do not have a right to make that decision for someone, even if they can't make that decision. So if you are having guardianship papers written up, please have them put in there. The attorney just needs to put in there, this includes right to placement by the guardian. Because we had that issue at Murray, DHS was, Department of Human Services, was going to come in and say, well, you don't have right to placement in here, and they were going to move our individuals, because they're saying we didn't have the right to put them there, even though the vast majority of these people are very either profoundly medical, mentally ill, developmentally disabled, and they have the need for guardianship. So although it does take away their civil rights, you also cannot take away their right to marry.
Yeah.
In Illinois,
Reproductive rights are also
absolutely. And the other thing is, I'm a nationally certified guardian too, and good guardians always include that individual on what. It's not like I'm going to decide because I'm the guardian. No, you work with that individual to talk to them, and that's the goal of the number one thing of a guardian, is you are to be that person. So you need to talk to them and discuss, well, what would you like to do? Well, as for my son, Mark would have absolutely, he functions like a 9-month-old. He would have no idea what I'm talking about. Jeffrey, who I'm a guardian for, has a 3-month, now Julie, who I'm a guardian for at Community Lane, she's able to talk about what she wants to do and whatever. And so as a guardian, sometimes being a guardian is the least restrictive environment because you enable them to get all the services they need. Whereas if they didn't have a guardian, they could be talked into a lot of things that would not be given what they really need. So, I mean, least restrictive doesn't always, it just depends. We want the least restrictive, but we also need to consider each person.
And when you talk about that, so first of all, it was a lot that I learned during the pandemic because of everyone's theories. So first of all, let's use the vaccines for a quick example. Even if you're guardian and a nurse goes to give Rita her vaccine, if she refuses, even though you're the guardian, they stop. They are not allowed to give that, even if the guardian says yes. If the person says no, they have that right. Exactly. The court has to decide what the person has the right to do and what they don't. And so many people misunderstand that. They also misunderstand it with power of attorney. Yeah. Oh, I have power of attorney. I get to make decisions. No, you don't. You get to make a decision when the person can't. That's what the power of attorney is. My son is the perfect example. He functions at about a 10 or 11-year-old level, but he is extraordinarily medically complex. But his verbal IQ is just like the rest of ours. So it's very confusing for people. He was born with a rare seizure disorder. And to give you an example, we disconnected the entire right side of his brain. So there's people that at first will think, oh, there's no way he could make this decision. He's smart as a tack. We go to doctors, and his doctors know to ask him first. But the minute somebody says, Lynn, we need you to sign this, he's like, Mom signs for me. Because that's something he knows he can't physically do, and he doesn't want to carry a rubber stamp and go through all that process. So part of the power of attorney, I signed. We don't have shared decision making because it wasn't in existence when we first started this. I don't need it. He and I work well together. Manor works well with us. They fully understand it. Routinely they'll send papers out, hey, we need a guardian to sign this. And I'll say to him, why are you sending this to me? Ask him. Whether it's pictures on their website or anything, because I want him making his decision. We all learned when our kids were in special education what least restrictive environment meant, or we should have learned it. But where an ICFDD is the most restrictive environment, if it's done right, it does not have to be.
Absolutely.
Can you say what that is?
Least restrictive?
No, I am.
ICFDD is immediate care facility for adults with DD and IDD. So most of them are medically complex, not all. Some of them are just more on the spectrum and requiring lots of care. Clinton Manor has every realm of it. But if it's done right, the person still can live the fullest life you ever imagined. And my son does. They work with him to do the things, the activities he wants to do. They have all these community dances and different things. He wants no part of it. But if you're going to take him out to go to dinner and let him have a beer, he's in. Or he's working on tattoo number 12, and they've taken him for 11 of them. Okay? And I will tell you, this is not the norm, folks. I'm very, very lucky that we live where we live. But again, and something Rita and I will talk more about, it also because they have the family involvement. Okay? And that is so important, and it's missing in our world. We transition from pediatrics to adults, and we're all used to pediatrics where our voice counted. Our voice was everything. And then we get to the adult side, and we have doctors that don't know what to do with us. They're not ready to equip to handle our children, and they don't want to deal with a parent. So we have to be educated about all of this. And that's the problem. Nobody is educating parents.
And I think they don't want to educate parents. I will tell you that, absolutely. The Department of Human Services is not enough. But it's true, because the more you know, the more you will advocate for your child. And you have to be that voice. You have to be your voice for them, especially if you have a child that The vast majority of the individuals we now have coming into Murray are between the age of 18 and 25, mostly males, with profound behavior disorders, and they're dual diagnosed, mentally ill and developmentally disabled. And you need to be their voice, because they have a voice and they definitely can say, but also they have so many issues. They need someone to advocate for them, and that has to be the guardian. Because if you are the guardian, or if you're not the guardian, even if you're the parent. And that is one thing Murray's been very, very good about, and as is Community Link. I mean, they listen. We're all a big team that works together, and that's what it has to be.
I would just add that Illinois does have a limited guardianship for certain people with developmental disabilities. Like I had a client with autism, but not like severe autism. His mom had a limited guardianship, which has some of the same things as a full guardianship, but a little bit more independence.
Ma'am, you had a question.
I had a question with the example you gave with the vaccine. How do you protect someone who can't make the decision? Like as a guardian, I would say, yes, they would need it, but it's my sister. She wouldn't understand. But how do you, is that written in?
So I'm going to give you the best example that I learned the hard way, okay? Like I said, my son has seizures. He has his entire life. So at one point we were using a rescue med, which is something you give for an extended seizure to stop it, that he hated. And he would do anything he could to avoid the med. So I lived 2 blocks away, which is a really important point to this fact. So he was refusing the med. We were at 15 minutes. The nurses called me. I'm like, okay, I'll be there in just a minute. So I run over, and he's like, I don't want to. And he could talk through his seizures, which is very rare, okay? But his seizures can also get very violent, depending. And I'm like, no, Lynn, you're going to take this medicine. So I helped the nurses. I kind of steadied his head. It was a nasal medicine. The nurses gave it. And we all are like, he's in a seizure state. My power of attorney should override anything he says, is what the 2 nurses and myself all thought. What we didn't know is it doesn't. The minute he said no, legally we could not give that medicine. And we didn't know this. And we got very lucky because they could have taken both of the nurses' license and they could have gotten me for abuse. So even if your sister says no, she doesn't want the shot, even though you've said yes, legally they cannot give it. And I realize that is really hard. But at the same time, and like I said, I learned this the hard way, we have to protect our loved ones to make any decision, right or wrong, that they can make, because we take so much away from them.
But also,
That's a really important
Yes.
point. Like, maybe not so much for people with developmental disabilities, but more like elderly people.
yes,
People have the right to make bad decisions.
if they have the capacity
Yeah.
to do that. And I know at Murray, it's a right for them, and we're real good friends with all the individuals now. They're really my life, not just our son. The higher functioning individuals will say, it's not my right. I don't have to take that medicine today. But they've learned very well how to work with them. Say, well, why don't we do that? Because they need them. Most times seizure medicines, but it is really difficult because they do have the right not to take it, and that right has to be respected. But I think really good nurses, after a while, you can kind of talk them into it, I guess, because they do need
but
it.
she doesn't have the capability.
Right, to decide that.
Making a decision.
The decision, right,
Yeah.
right.
I was looking, one of the nurses from Manor was going to try to come, but apparently she hasn't made it, because I was going to let her join on that, but
That's a really good point.
yes, okay.
Go
So-
ahead, I'm sorry.
Carrie and Rita, from your experience as parents and guardians, what are some of the biggest decisions families face when their child transitions into adulthood? You talked about the medical and how to interface with medical personnel and things like that, but what are some of the other?
So, our kids can be in school until they're 22 if we choose to keep them there. My son, because of his, like I said, verbal cognitive level, he wasn't staying. He was doing 4 years of high school and he was done, because that's what his brother was doing, that's what everybody else was doing. So, okay, so then, you look at day programs, and we tried them. He hated them. So, and he's like, I'm not going. So it's really hard to figure out what do you do next, what is the best thing for your adult child. And every set of circumstances is different. Part of the biggest problem we all will have is that the school districts, no matter where you are in the state of Illinois, or in the country really, don't do transitioning the way they're required by law to do it. They're supposed to start when our kids are early teenagers working with us to come up with a transition plan. It doesn't happen. You get told, oh, here's a day program, go check that out. And oh, you have to get on the PUNS list, which we'll explain to you. And you might wait 5 years for funding. What good is that doing any one of us? Or our children, because then we wind up keeping them home and we're isolating them, which is the worst thing for any one of them.
And for myself, our Mark, frankly, is the same Mark he was when he was a baby. He's no different except he's 6'3". I mean, he had no idea he's 18. He does not have that comprehension at all. So for him, there was no transition. That was just Mark was now 18 or 19, but he was really a baby, which he still is in this huge man's body. But for my brother Mark, at the time, we were very fortunate that he graduated from high school and he had been with many of his friends since kindergarten. And so he'd known them his whole life. So then they just all, at that time, there was no PUNS list. Community Link was there. He went to their day program, absolutely loved it. And so there was no real transition. But I know with the individuals at Murray, many of them who especially don't have guardians came from Harleton Children's Home. They lived there their whole life. They turned 22 and they're done. There's nowhere for them to go. So then when they didn't know what to do with them, they came to Murray. Many probably, not many. Some do not need to live there. They could be living in the community, but because they have no families to really advocate for them, so they came to Murray. So now they're either at a workshop, a day program at Murray. But it is very, very difficult because when you're in high school, and especially in Illinois, and I believe everywhere, because nationally I hear the same thing, when they turn 22, there's a lot of times nowhere for them to go. And just for them to live at home and do, quote, nothing is really, really hard on them and everyone, especially if you can't be home all day with them. Many people can't. And I don't know what the answer to that is, but that's the reality.
Well,
and after 22, if they're going to a program or activity like Challenge Unlimited,
yes,
is the state or whoever provides their transportation and stuff like that?
Some of it.
Some of it.
It depends on your funding and what program you're in.
What program?
But is that something you would have to be referred to, or you can just pick up on your own and say, okay, he's 22?
No, because the PUNS list is, I don't know what it stands for, priority of something and needs.
Okay, it's on the PUNS list.
But if you're not getting
about
funding,
5 years, I don't know what happens.
Right. And if you go ahead, and if you don't have funding, that is the huge problem, even for the day programs. If there is no funding, your child often will sit at home for years until, quote, they get funded, which is...
Right. Somewhere on here I have a slide about the PUNS list.
Yeah, that is a big...
You look, I'll talk. Okay. So, and that's the whole thing. So, like, my son was home for years because he didn't want to be. And I thought we were still doing a good job socializing him until we wound up having to move to Clinton Manor. And I will tell you, when I use the word having, I mean we had to. We were getting, because he qualified under traumatic brain injury, we were able to bypass the PUNS list because the TBI program is an entitlement program. So it's a guaranteed funding under Medicaid. But, so I had in-home care for him. We had moved down here to Southern Illinois a year prior. Our caregiver from Central Illinois moved with us to take care of him. So we were well set up. But he stood up on a Saturday morning and broke his leg in 2 places at 25 years old because he had severe osteoporosis, and they heard his leg crack. So he went from a 1-person to a 2-person transfer that fast. We tried reaching the state on Monday to get some additional care. The person we needed was out of town, and they would get back to us. The following day, at 45 years old, I had a massive heart attack and needed a quadruple bypass. And I didn't do well with surgery, wound up on a ventilator for 9 days. And the reason I'm telling you this is because when my husband and my twin sister called the state agency explaining, this is what's going on now, we need emergency help, which should have been given to us. Instead, we were told we had 6 weeks to find a placement because I was no longer capable of caring for my own child, and they were cutting my funding off in 6 weeks. And when I woke up and I started cognitively coming to, when you're on a ventilator for 9 days, that cognitively coming through takes a few days. I totally forgot that I could appeal the process. And if you appeal something, most things in the state of Illinois, if you appeal, it freezes right then and there. They can't touch what you're receiving until you go through the appeals process. In the end, it was the right thing that I didn't appeal it. So he then was entitled again for an entitlement program. We got very lucky. We were living in Lebanon, that Clinton Manor had a bed, and they had a male bed, and that we could get in there when we needed it. It was all just happened to fall right, and a very good friend of ours who worked for the Epilepsy Foundation helped the process, because I couldn't do it. He was miserable, I was miserable. I told people the state stole my kid, because that's what I felt like, even though he was 25 years old and he was an adult. It did not take long to figure out this was the right thing, because he had socialization. It wasn't so much that the residents that he would connect with so well, but it was the staff. And that staff today is his family. The residents today are his family, especially now we have more higher functioning people, so there's more people that way for him to socialize with. But even the other ones, he'll be the first to say, hold on, stop talking to them like that. They're not a baby. They learn to stick up for each other.
Absolutely.
Okay?
Absolutely.
We as parents, no matter how much we love our children, I will be the first to tell you, I learned it the hard way, and I've seen it with everybody else. The longer we keep them at home, the more we're hurting them when this has to happen. Because of moving my son emergently.
Yes, and I'm going to share.
How old was he at that time?
He was 25. He didn't understand it. I didn't understand it. We were both miserable. And I made Clinton Manor's life miserable for a very long time. Okay? Now today, Clinton Manor can't buy the advertisement I will give them. Okay? Because I speak publicly, nationally. But it took a lot of years to get from where we were to where we are. And I love it. I love my son's home. I bought a house 2 blocks away, so I was never not there.
And I want to share my brother's story, first off. And first off, something that none of us as parents want to accept. There are people there that can do a better job of caring for your child than you can. That's true. Period. Amen. My son Mark is the happiest child. He can walk. He walks all over. He gets life, everything he wants. You know, he taps people. They give him little Debbies. I mean, he is so happy. And I couldn't do that at home. We live in a little ranch house. We have one, hallway. We have one TV. He has, he goes to everybody's room now, finding the best TV channel. His life is so happy. We could never. He has so many people that love him. My brother Mark lived at home with my mom for 58 years. She was not going to let him ever move anywhere because she was going to take care of him. And he was miserable. He was on a lot of psychiatric medicine that she did not, we find out later, give him. He became suicidal. His best friend David moved into the CILA. Mark wanted to move there. We talked to my mom. This was not happening. It was a disaster. He was miserable. He threatened to kill her. He was going to kill himself and his dog. The doctor called me and said, you either do something or your brother's going to kill your mom and him, because she wasn't given his medicine, which we didn't know. He was miserable. I was close to him. I pretty much raised him as a child. She had some mental health issues. So what happened on a Sunday is she had a massive heart attack. So Monday morning, what are we going to do with Mark? He couldn't really come live with any of us. So we had always been involved with Community Link because he went to day program there. So that happened on a Monday. By Tuesday, I'm getting a hold of the state. At that time, I had no idea how the state worked, or Community Link, and thank God by Friday, they found a bed for him in the home where his best friend David lived. It was a miracle. I mean, it happened. They had a bed for him. He moved in. Well, my mom then moved into a nursing home right in the backyard. So we're thinking this is a wonderful situation. Mark has his home. Mom can be there. They go back and forth. He'd go there for breakfast. Well, my mother, when she got over having, she still had heart condition, she wanted to move back home. And because she had guardianship, she was going to move back home. And I said, you can't do that, Mom. He's going to die. And she's like, nope, I'm moving him back home, and he's going to take care of me. I'm like, oh, that makes our whole family, you know, he has 6 other siblings. We all argued with her. It was horrible. And I finally said, well, I'm going to have to get guardianship. And he got a guardian that liked him, who talked to her. She was totally unrealistic. Her goal was that he would just die first before her. And, you know, that doesn't happen. That is a dream for guardians. I mean, for mothers. We think, you know, then our child is okay but that's not the reality of life. And she would never accept this. So I'm going to go to court against my mother and get guardianship. And I got guardianship because she was so unrealistic. And, you know, the judge knew this. And Mark was farthest, my brother, but he's very torn for many years, you know, because my mother would tell him horrible things about me. And it was just not a good situation. But, you know, as we get older, we think, who is going to take care of our child? And you need to make that decision so that you don't do like my brother Mark, living at home 57 years in Albers with everybody he knew and loved. Moving down the road in 5 days' time, his whole world was just totally, you know, destroyed. And it ended up being the best thing ever. And after 15 years, my mother told me, yeah, it's the best thing we ever did. You know? And but it was, but we don't want anybody else, and you don't want your loved one to go through that. You know, if you can do something gradually while you're here and still visit them. I mean, you know, we were there all the time. We're still there at that CILA. He's gone, and same thing. So,
And it's common for parents like us to think that our child is going to pass before we do.
Yes.
That was my plan, folks. You know, my kid's had brain surgery. He's had 3-hour seizures, all these things.
Yes.
He has 12 doctors. How is he not going to? He is healthier today than he's ever been a day in his life. Mm-hmm. And it's because of Clinton Manor and the work they put in to helping get him healthier than he's ever been.
Right.
So now I'm in the life stage of making plans for him for when I'm not here. Okay.
So before we hit on that subject,
I'm sorry.
let's go over a couple of living options here. We've already talked about intermediate ICFs, intermediate care facilities. So there are a couple of others. There's a state-operated developmental center and community integrated living arrangements, CILAs. So what's the difference between those 3 living options?
Okay, well, I can tell you about state-operated developmental centers in Murray Center. There's 7 of them in the state. Some are better than others. We are good. We are very, very family-oriented. There's 7 cottages. I have free reign to go everywhere. I know everybody lives there, and I'm their substitute mother, I guess, you know, for everybody. Very, very family-oriented. They're not all that way. They are much more restrictive as far you're living in the way Murray's set up is kind of like Clinton Manor. It's more like the nursing home, you know, like there's 4 units and there's 6 cottages. It is really for people who cannot live in the community for many reasons. Either medically, they cannot, I mean, they don't have nurses in CILAs round the clock. That's more like a home you live in. Whereas my brother, there were 6 people that lived in this beautiful home. And, you know, it's just like a house. You live there and you have somebody that comes in, a DSP that lives, you know, stays there with you round the clock. Whereas at Murray, you have nurses, you have doctors, you have physical therapists. You have them all there every day because most people need that. That's a state-operated developmental center. There are also privately owned ones like Bryan Manor.
Clinton Manor
and Bryan Manor, those are private, but they have the same thing. They're going to have nurses. It's for people who just need more care. Much of what we have at Murray, over half of our individuals now are people who have a lot of high behavior needs. They are labeled, I assume, autistic with severe behavior needs. You know, they tried probably. One of my dear friends that lives there has been in 25 CILAs before the state of Illinois figured out that he should really come and live at Murray, and he's very, very happy, you know, because he has the structure he needs. So, but the Bryan Manors and probably Clinton Manor, more the people who have medical issues.
Right, and like Clinton Manor doesn't do trachs. They did it once. They realized it was too much. I don't know about Bryan Manor because I've never been, but you know, and Clinton Manor it's very high medical need. I mean, my son receives round-the-clock medical care. He's a type 1 diabetic with epilepsy, the worst combinations you can have, on top of all these other things. you know, we have some residents, because again, I'm like the substitute mom too, with all of our residents, and we have residents that have been catheterized for 20 and 30 years, and they need somebody to help care for their catheter. So it's a whole variety and a gamut of what they have. And then there is the medically complex MCD. There is one that is even higher level medical than what Murray is or what Clinton Manor is, okay? And those are the really complex medical people with trachs, you know, people that probably, you know, run IVs all the time, you know, all the different things, which anyone that has registered nurses can do some of these things. But how much can they do? That's where the licensure changes. ICFDD, SODC, and the MCDD are all entitlement programs.
Yes.
So if you have Medicaid and you need your kid there, they're entitled if there is a bed.
They will
Okay?
tell you no, but that's not true. It is true.
True.
That is
It's an entitlement program.
It's an entitlement program. So
Right. But the CILAs are not. Home and community base is not. The reason this is so important to me to do this is, you know, the federal government's going after home and community based program. There's no question. You know, Kennedy thinks that if there's fraud and that parents are milking the system, we all know this is not true. Any one of us that have cared for our kid at home, we know we're not committing fraud. They couldn't pay us enough for what we're doing. But the problem is going to be all of these kids, and they're not kids, they're adults, are not going to have anywhere to go. And they are going to wind up in nursing homes because there will not be enough beds for them. And the reason I want to do this is I want people to understand you need to plan ahead. You need to get on waiting lists.
Yes.
You need to go check out homes and start looking and making decisions, because if they want it for the nursing home at Clinton Manor, you're okay, because they know how to deal with it because of the other side, and they will work their best to transition them. You wind up at most any other nursing home, they don't know how to provide appropriate activities. They don't understand family care, the level we want. Our guys wind up in worse condition, and no fault of the nursing homes, because they're not adapt to have them. But they wind up with them. And then the behaviors get worse, the health gets worse, the depression gets worse. Not just for the person living there, it's also for their family. Again, this is why I'm working with a group trying to do a different plan. But these are going to take time. In the meantime, don't wait, because it is, it's going to bite you in the butt. I'm the best example, and I just got lucky. I truly got lucky that Clinton Manor had a bed when I needed it for myself.
So what do y'all recommend for a disabled adult that's developmentally disabled but medically stable? Like they don't have any severe medical needs, but developmentally they would not be able to be independent.
are you on the PUNS list to be receiving services?
Yes, he's been on the PUNS list. He's at I think since 9th grade.
Are you working with someone like Prairie Land or Southern Illinois?
I think their name is called Prairie Land, and these are the people that do the PUNS services.
Yes,
and keep on them.
And call them and say, you know what, I'm interested in something.
Right.
You would probably qualify for a CILA.
Okay.
And, you know, but that you need to talk to them and say, I'm interested, because it will probably take, I think I just read 5 years.
Yes, so actually
get started.
Here is, okay,
Oh, good.
as of March 2nd was the most current data I could find. Here is the information about the PUNS list. According to the state of Illinois, almost 18,000 people are eligible, and I think that number is way off, you know, and these are what they say these 18,000 people are wanting. These numbers can't even be close to accurate, okay? I know when we were living in central Illinois and we were in a school district that was a co-op, 2 counties for special ed, there was probably 3,000 kids in special ed. Half of those kids would fall under these categories. So, you know, what's missing here is the ones the parents don't know what a PUNS list is. And they don't know what an ISC is, which is the service coordination. So it is so important to work with your service coordinator to find out what your options are. Go look at Murray Center, go look at CILAs, go look at Clinton Manor, look at places close to you, and decide, okay, I have an interest here and I have an interest here. Do they have a waiting list? Get on that waiting list.
And frequently.
So this service coordinator is through the funds program?
Yeah, you can find the information for that, I think, on DHS's
Correct.
website
So
when
yours
you
is
go to
probably
that
Prairie
page.
Land, or it'd be
Yeah,
Southern Illinois
yeah.
Case Coordination and Centralia. It would be one of those two probably if you're from this area. That's
Right.
the ones that are usually.
And they, even when you're in somewhere like Clinton Manor, they're supposed to come in yearly and talk to the person that is living there, saying, do you still want to be here? Is this where you want to be? Is this an appropriate placement?
Because once you live there, and that is a fallacy too, because some people think like once you move your child to Murray Center, they're going to live there forever. That's not true at all. I mean, some of them come and they stabilize and they stay 6 months. Some stay 5 years. Some stay 10 years and move. I mean, once you're there, it's not like you're, quote, stuck there, I guess is the word. There's always that CILA option. There's always some other option. We've had 2 people that moved back with their families. You know, it just depends. But some kind of service is so important.
Okay, so we kind of segued to living options, but now planning for the unexpected. Planning, to, as Carrie said, planning for the time when, as parents, we're not there.
So what I decided was it was more important to plan for Lynn first, and which meant we met with an attorney. He has an actual will. He has, all the medical paperwork that you need for POA, for his a living will. All of it's done for him with his choices. He was very clear. He's watched my father-in-law and other people go through dialysis, and he has it clearly stated on there that he will always refuse dialysis. He made the choice of, did he want to be DNR or not DNR, and what does that mean? And I'm lucky. He has an understanding level that a lot don't. Because of what he has is so rare. He's always said his whole life, because we've donated blood and skin tissue and stuff over the years for research. He's like, Mom, they can have it all. If that's what will help, he said, if I can prevent anyone from going through what I am, they can take it all. I realize most of our loved ones can't make those decisions, but get theirs done first. Because if something happens to us, we don't want them suffering. We don't want somebody making decisions that what would not be the right thing for our loved one. And then make your decisions and make sure what you do is working with a really good attorney and that your paperwork is in order. And if any of your loved ones say, oh, I'm setting up a trust for them, make sure your attorney has looked at that trust.
Right. And then, yeah.
Because let me tell you, my parents set up a trust for my son that 3 attorneys clearly said this is the worst written trust they've ever seen. And we had to find a loophole to bypass the trust and move it to a different trust. It's difficult. Yes. So, and that's the other thing. Kids have grandparents, aunt and uncles, oh, I'll help take care of them. Be careful. First of all, if the money's not set aside right, it's going to mess up their Social Security.
Right. And the other issue is, and how I became guardian for Julie, who I'm not related at all. She lives community link at a different CILA than my brother did. But I knew her mother, and her mom was probably 80, but in pretty good health and everything. She said, I don't know what I'm going to do. I have no one.
Oh, it said it needed to restart. I don't know.
I have no one that can take Julie. And she said she will become a ward of the state, which will happen if you don't have a guardianship thing set up. Who's going to do this next? So I thought, we can't have Julie become a ward of the state because, we can't. So I just said, well, you know what, I'll do it. Which I don't know why I really said that, but I did. And really 3 months later, her mom had everything set up. She then put me as the guardian, it was all worked out. It was probably 6 months. So I had time to know more about Julie. We talked about what her goals was. Her mom told me what she wanted for Julie's life. We worked together. And I guess 6 months later then, her mom woke up one morning and fell over and died of a mass heart attack. But at least Julie then knew me. We had this set up. Or she would have probably been a ward of the state, and that you probably don't want that for your child. And it's a hard thing to think about. And another issue in the state of Illinois, if you are a successor guardian, that used to be pretty much you would just get to become the guardian if someone passed away, but now you will still have to go back to court, so you might want to have a second guardian. Like my husband, he was always the successor guardian because you figured, one or the other. but now he's actually a co-guardian with me, which is different, and our son is a successor guardian. So just check if the attorney you have is someone that is, knowledgeable about developmental disabilities.
And we've done the same thing with POA.
Yes, because that's really,
And
not
I just
everyone
want
is.
to interject a second. The reason trusts are important is really for Medicaid. Medicaid has an asset test. In Illinois, it is $17,500 that you can have in any kind of asset and still get Medicaid. So if you get some big inheritance and that family member or friend has not planned properly, there is a special Medicaid protected trust. It's called a special needs trust that includes language in it about Medicaid that will protect that money from being counted as an asset for Medicaid purposes. That's why that is extremely important. SSI also has an asset test, and a special needs trust exempts the asset there. Another thing about SSI, I should say, there's a special thing called an ABLE account, which if your disability started now before age 46, the person can open or the parent can open. That can have $100,000 in it, and it's not counted as an asset. So that was one thing. The other thing I wanted to add was a different example from your story. My mom used to be a state guardian or a public guardian. In Illinois, those are for people who have estates over $20,000. If it's under $20,000, the person is referred to the Office of the State Guardian. That's for people who don't have a family member or a friend to be the guardian. So this is the guardian of last resort. In my home county, several years ago, a woman was found walking down the road. What had happened is her parents died closely together. Her parents had not planned for anything, and she had severe schizophrenia. Her parents had helped her with everything, and when they were gone, no one was checking on her, no one was helping her. Her neighbors saw her walking, and she got referred to the right services, and my mom became the guardian for her. But that is an extreme example of what happens when you have not planned. So you should plan for your children. You also need to plan for yourselves. There's something like only 30% of Americans do advanced planning. It is extremely important to have those documents in place for when the worst thing happens, if it happens.
And Tracy, what are the base documents that people should have?
Should have
At bare minimum.
Yeah, you should have powers of attorney. So there is somebody who can make decisions for you in the event that you cannot. Some kind of will or trust. Those are the base documents. You can also have something, physician orders for life-sustaining treatment, and like a living will. Those are not really alternatives to a healthcare power of attorney, but they provide guidance for end-of-life care.
And update them.
Yes.
Like, I have a medical power of attorney. It's my husband and my other son. The first one was done when I had my heart surgery 13 years ago. I had another surgery like 5 years ago. We did it. I'm having surgery in 2 weeks for something else. I am going to update it before that. Keep them current. So the addresses, the phone numbers are current, and the person you want. You have the choice to change that person you want.
Yeah.
My son decided he loves his dad, but he decided his dad would not make the right choice for him, in his opinion. So he took his dad off and put my husband on. And that's fine. It is his choice to make. And I realize a lot of parents can't allow their child to make the choice, okay? But the ones that can, I strongly suggest you do. I really think the more I've got to know Rita and some of this, that I'm going to take this Guardian program to learn, because I know I've watched in our building multiple residents that have had state guardians, and it's appalling to me, the care they get, extending their life unnecessarily when the person's suffering, because the guardian, legally is like, right, oh, well, let's try this, let's do what's best for the person. So,
And I have to say, we have one of the best state guardians ever at Murray Center, and he works with all of us. I absolutely love him. I'm really good friends with some of the people he's a guardian for, and I take him out during the week and whatever. And that is a really big thing for him, because he doesn't want to. He gets a lot of pushback from some other people, because he said, we have to do what's best for them. Not just because, they're so worried about legally, do we need to do this? He said, we have to think, what would we, as ourselves, which is what you're supposed to do as a guardian, you're supposed to be that person. How would we feel, what would really be best for him? But that is a really good point. I mean, if you can find someone besides a state guardian, because I'm sure they're not all as good as he is. I know they're not. And that's really tough if you don't have family.
And if you have any question that the family is not the right person, please don't. We had a resident that I loved with my heart. He was my son's roommate for a long time, and then he was in the room next to him. His mom passed pre-COVID, and, he would tell everybody I was his friend. He never could get my name right even after 10 years, but that was okay. But I was the other mom for him, and he happened to pass in his sleep one night. After his mom died, his brother became his guardian. I think his brother might have seen him once in like these 5 or 6 years.
It doesn't have to be family.
And then I'm like, my son calls and tells me that this person had passed. I was hysterical, came right over, and I had seen him the night before and hugged and kissed him, because I always gave him a hug and kiss on my way out the door. And so I'm like, okay, now what? And they're like, well, his brother, has had us send him to this funeral home. None of us ever figured out what happened after that. We never know where the body went, if they did a memorial, anything. If there's any way to put somebody who truly cares, and cares does not have to be a family member, because this person deserved respect and deserved a quality ending of life. I don't know how I would have figured it out. I would have paid for it myself if I would have had to figure it out. And this never happened. And we still to this day, 2.5 years later, I have no clue what happened. And for me personally, it's devastating.
So we've covered a lot of information today. A lot of information. And we've probably still got information that we could cover. We've covered benefits, to funding, to living options, planning for the future. And now it's time for questions.
Tracy mentioned a benefit or something for someone who was disabled before they were 46 or something. Tell me the name of that again.
It's called an ABLE account.
ABLE account.
It stands for something. I don't remember what
I can't remember what the acronym is.
In Illinois, it's run, I think, by Fifth Third Bank. You can find a pamphlet for it on the Treasurer's Office website. But they just increased the age to 46. So if you become disabled before age 46, you can open an ABLE account, and that is a way to protect.
It actually started with Medicaid for the age-blind and disabled, AABD, because the income limit's $2,000, or the asset limit's $2,000. And what if something happens? We all know if the water heater goes out. So this allows people who are lower income to keep a savings account for those emergency situations that they weren't allowed to keep with Medicaid, with straight Medicaid.
It stands for Achieving a Better Life Experience.
What happens when that person dies with the money that's left in the account?
Oh, that's a good question.
I think it goes back to the state.
I believe it does.
I'm not entirely sure, honestly.
Right. So and we have a special needs trust.
We have a special needs trust, which is different.
Right. And like even in my son's will, the trust clearly stated, the original trust, where the money was to go. And like I said, I found an attorney to figure out how to loophole that trust. But we had my son put in his will what he wanted. if there was anything left, because that, by law, actually was able to supersede the trust, because it was his desire for his asset. And he wanted it to go to his brother or his brother's children, if there were children. So if there's anything left, he wants it to go to my grandson, which is fabulous. I promise you, because of how it's written, there won't be a dime left. My son spends it. He doesn't even know what's there. My goal is to let him blow every penny the way he wants. My husband and I can afford his needs. And we do. And we've done football games and wrestling. Spend the money. I don't care. But I'm lucky I have that advantage, and it's not a ton. But if he knew how much it was, it would be a ton to him. But in the real world, it's not. Why not?
Hold on a minute. Abby, did you find the answer to that question?
It is. It's Medicaid.
I did not bring my phone with me, so I don't have the internet on my fingertips. So this is from the ABLE site. After the plan receives notification of death of the account owner, the account will be frozen and a copy of death certificate must be submitted to plan. Authorized individual on the account or individual with authority to administer account can request a withdrawal to pay outstanding qualified disability expenses and funeral and burial expenses. Request must be received within 90 days of notification of death. Assets from account may be distributed after at least 180 days have passed since the date of the account owner's death, and any outstanding qualified disability expenses, funeral, have been paid. Any state Medicaid recovery claims that have been filed have been paid also.
That's the big one.
That is probably when you say go back to the state, that's what it is. There is, the state of Illinois has a state recovery.
That's mandated by federal law, although some states have tried to do some things to exempt certain stuff from recovery. But when you use Medicaid for long-term care, the state makes a claim against the estate for that money.
And you can also appoint a successor account owner for that.
Tracy, I have a question about the legal part of this. Do you have a list of lawyers that you could recommend for this, these special needs trusts, or do you stay away from that?
I do not.
We can give a list of attorneys. Here's the thing, we are not recommending, we are giving you, you tell me you live in St. Clair County, I'm going to give you the three. But that is a very important point. You want to make sure you get an attorney that is specialized in special needs trust. There are a couple in the area that do.
Right, so like the attorney I used, Rita recommended to me.
Yes.
Okay?
It's in Clinton County.
Yeah, she's in Clinton.
Are you allowed to recommend?
Oh, yeah. Yeah. And our cards are right here.
Okay.
My card.
We both have cards.
And then you can.
I moved the screen deliberately so you can see our email addresses.
Yeah. And then I will let you know, because I was very pleased with them.
I have a question about Social Security. How does the maximum family Social Security work? Maximum when?
Yeah, that's when there's auxiliary beneficiaries, or if you're on DAC and the parent. It's a set amount, and it's kind of a complicated calculation that I can't really go over here. But there are, within Social Security, something called the PALMS, which is a manual that they use, and it has the calculation in there. The family max is what you're talking about.
Okay, so there was somebody else that had a question.
And you can just Google Social Security POMS and
POMS.
Yeah.
Okay, so give us 1 second. Back there?
Yeah.
Sorry.
So isn't there like two different kinds of special needs trusts that get irrevocable and revocable or something?
Yeah.
I was always confused about what that really means.
Irrevocable is the person who's making the trust can't later change it and get rid of it. Revocable is it can be changed.
So revocable would be the better.
It depends on the law, but I think it has to be irrevocable.
It has to be irrevocable because it can't be something. So if I set up a trust fund for Tracy, and I make it irrevocable, Tracy can make changes, which means she has control over it.
Revocable.
Revocable, sorry. I'm not a lawyer. If I make it irrevocable, then Tracy has no control over it. She benefits from the trust, but she can't make changes to the trust.
And you don't want it, there's like, what, a first person and a third person?
Yeah.
Because you don't want it in
Before,
their names.
yeah, before I think 2016, the Social Security law was different, and it had to be a third-party trust for the special needs trust. After then, it changed, and it can now be a first-person trust. But Social Security reviews the trust document to make sure that it is an exempt trust for SSI purposes. So that's why it's extremely important that the attorney drafting it is familiar with the Social Security and Medicaid rules.
So I'm going to add one thing. I know at least one person in this room is military. Okay, depending on how many of you guys are military, I have no clue. Rita probably has no clue. Make sure you're asking those questions, because obviously, first of all, your survivor benefits are different.
Yes.
All of your benefits are different. So you need to probably start with somebody on base that can help you figure this out, because all of the rest of the benefits your child receives will be different. You know, I'll give you an example. We have somebody in Clinton Manor who has Medicaid, Medicare, and TRICARE.
And TRICARE, same thing at Bryan.
Okay, so that changes the whole equation versus Lynn, who just has Medicaid.
And also, like, the funding at Murray is somewhat different too, and it might be the same there. But like, if you have someone who's been in the military and they died and they have veterans benefits, that does get sent.
Right.
And my brother did too in the civil, though. He also did. I'm
We
sorry.
just coincidentally worked with a lawyer yesterday and finished up a plan, and she had a whole folder based just on that.
Yes.
Yeah.
Good. So, did you have a question?
I had a question about the special needs trust. If you know, if it is drawn up in another state, and the person that is for, they move here, do I need to redo all of that? There's no in another state?
So my son's trust was established in Arizona.
Okay.
When my mother passed, my sister was the executor of all the trusts, and she lived in North Carolina. My brother was the successor, and when we ran into the problems it became very complicated, first of all, of what state was this going to be handled in. And, you know, finally, when my attorney found the loophole, we convinced my sister to turn her trust to my brother, who had the right to say, I can't handle it, and then it wound up going to me so we could get it here. It was very complicated and very expensive.
So I should probably write that here?
Yes.
I would think
Before
so.
my
Same
mom
thing with
passes.
guardianship.
Yes.
The
Guardianship has to be
and
transferred.
every county is kind of different. And something which we didn't do in Clinton County for a long time.
Or registered. Maybe not
Registered,
transferred.
yes. Just make sure that it is registered in your county, and then every year you need to fill out a form, and those differ from every county.
And you want to stay ahead and do all of these things, because when they haven't been done, it is a nightmare to go back. The same thing, you know, especially if you haven't applied for any services yet, if you can get hold of any records from when your kid was in school, grab them.
And school records are incredible for Social Security disability.
Right.
Yes.
Okay, go ahead.
I had a question related to Social Security, but now the disabled adult, he receives survivor's benefits from his mother's passing along with another sibling at this point. When the other sibling reaches 18, because she's not 18 yet, does he continue with these survivor's benefits the rest of his life and never goes back to SS?
My brother did, yes.
Well,
Depends.
unless
Because when he turned 18, I was surprised that they told me that no, he doesn't get transferred to SSI or whatever. He continues with these survivor benefits.
Yeah, as long as he is a disabled adult child,
yes.
but if the disabled adult child marries or works over substantial gainful activity, which is an amount set by the Social Security Administration, then it cuts off. Marriage completely cuts it off. work completely cuts it off and you cannot get back on unless your other parent dies, retires, or gets disability.
So what would happen? He would have to go and
The
apply
Social
if he
Security
wanted for
Administration when that happens, if somebody gets kicked off now, they usually put them on SSI, which is a lesser benefit.
Yeah, so my daughter has been on SSI. I'm going to start claiming my Social Security, and I already have my appointment set up for her to convert to a DAC structure. So she will then be paid under the Social Security Administration program. When something happens to me and she would get survivor benefits, does she have to refile for survivor benefits, or she just maintains?
She should maintain. Social Security used to be really good about catching that somebody died and now the benefit increases. Lots of stuff has happened to the Social Security Administration the last year. They're not so good anymore about catching that.
Well, you're saying it nice.
So they'll have to follow up on it.
Okay, so
to make sure that transition is happening.
I call it the better safe than sorry.
Yeah.
So let's follow up on
the
it.
family maximum.
Right.
Because of the family maximum, she would bump
that
up.
happens when you retire.
Right.
So let's add something to that, which is your Medicare and your Medicaid.
Yeah.
Right.
So as soon as you get Medicare, so does
She
she.
already got it because she has it under my husband. So
Okay.
she has Medicare with Medicaid as a secondary.
So first of all, Medicaid is the payer of last resort.
Right.
So if you have, no matter what you have, it goes in that order, that Medicaid is last, and they will make sure it's last.
Exactly.
The co-pays for Medicare a lot of times still work. There are ways to apply for assistance, so you're not paying the Medicare costs. But
So one of my other...
since she's already on your husband's record.
Yeah, but my record will be higher.
Okay, that's what I was going to say. If your record is higher, then they
He
would
was
probably
a
put you on
state
hers.
worker as a firefighter, so he has a pension, so he has a much lower benefit.
He shouldn't anymore.
Well, that's what they told me. They said he could jump over as an accessory under mine.
Well, actually,
and
they
his
got
would-
rid of that windfall.
But it's still mine's still.
They eliminated the government pension offset in 2024.
He got a little bit of a bump, but it was not significant because most of his income was coming from the pension. So, but my other question, just, and this was something Social Security couldn't answer. Because under SSI, the income limit is the $2,000. They said that goes away once she goes under the SSDI.
Yeah, SSDI has no asset limit.
Right, there's no asset limit.
DAC does not have an I'm sorry.
No.
There's no asset limit.
There's no asset limit, and I said, so how does that affect the Medicaid? And he's like, I can't answer that question.
Medicaid still has an asset
Okay,
limit
no,
because she will be on age, what is it?
AABD.
Age and,
disabled.
yeah.
Okay.
So,
That's the 17.5?
yes.
Okay.
When you are on basically ACA Medicaid, which is for people who are under 64, there's no asset limit with that one, but when you are specifically on the aged or disabled Medicaid, there is an asset limit.
And trust me when I tell you, Medicaid doesn't miss anything.
No.
So my son at 20 needed an electric wheelchair for the first time. I was like, the company I worked for was very clear with my insurance, get him what he needs. I worked for a very small company that was self-insured. So we had the Cadillac. Medicaid wound up covering a couple $100 of this wheelchair. That was it, because they were the payer of last resort. So 3 or 4 years later, we needed something. We were debating just getting a new chair. And they're like, oh no, we paid for a chair. You have to wait 5 years.
Yes.
And we're like, hold on, you did not pay for the chair. Oh, we were trying to get a second chair. I wanted a manual, too. And another thing, they won't cover 2 chairs. So making sure you know what your benefits are, because if you're in that position and you have to choose, trust me, you don't want to buy the electric chair. You want to buy the manual chair. So it's all of those things, and if you're setting a trust up, which is the one thing that the attorney did right for the first trust, was it was written in there that this trust could be used to cover anything Medicaid would not cover. This is how it was written. It was also written that this trust is established for anything Lynn desires. And my mom was very clear, concerts, sporting events. She made sure that we went as wide as we could. So that way there was never an issue about what do I spend his money on for him. And trust me, I've spent it on football games and wrestling events because I'd rather do it.
Okay, we've got just a few minutes left. I'm going to go here first for question.
Well, first of all, this is my daughter Jennifer.
Hi, Jennifer.
Nice to meet you. She was at home. She said she has mom a little shy because, you know, mom travels the world with her. She's world-class cheerleader. She's in lots of Special Olympics. She works at Reading and Degrees.
Oh,
She goes to college for life at Lewis and Clark. There's a mother. There's a couple, so that's another thing. I mean, the child is
But that's great.
It's trying to be a combo. Dad's retired military, 30 years. So I know about military stuff. I found out we have the best attorney. She works with AgeSmart too. She talked about, she helped set up the military because with the, you know, Jenny gets part of Jim's stuff when he passed. So she helped set up and rewrite everything when they went in. And then I found out that, you know, Jim can be buried Judge Barracks or something. I can be, as Jennifer can be. So it's a lot of paperwork, and I don't even know where I'm eligible to, but I don't know anybody else is. So it's a lot. I mean, our daughter is, you just think you have everything done, and then there's always something new. So you need to update it. I have guardianship, but I always ask her about stuff. I have her sign when she can. It's a lot. And Jim is now in memory care. And Ryan has helped me when we had this thing. So we have SSDI, and we got it years ago. So she has Medicare. The only reason we have Medicaid is for the funds list, because you need that for the waiver. And so I don't even use that. So we are really blessed about everything. I mean, it's just, we've known these ladies for like 20-some years or something. So I just put this out here the last minute. So there's so much information, and you think you do something right, and you're not sure, so you do need to. But yeah, so a lot of this stuff applies for if you have an older person that needs to go.
Right. So, and I'm going to piggyback on this. So I volunteer with an organization out of New York, and we do monthly webinars. And 2 months ago, we had a VA specialist on. He was unaware of the fact that if a veteran has a disabled adult child that's always been disabled, that child is entitled to be buried at the military cemetery. I taught him that. So ask questions, because nobody can know it all.
No.
You know, there's so many, correct, there's so many programs that change yearly.
Nearby, right? The VA nearby.
We actually, the vet center is right behind us in West Point. That's more of a counseling center for veterans. So, but each county has a veteran service officer in the state of Illinois. If you're not sure where the veteran service officer is, you can always contact the local VFW or American Legion. They are in contact with the veteran service officers. A lot of the VFWs and Legions also have somebody that's associated with that particular organization, that particular location, that can help with benefits and get a person directed in the right place.
I just want
You don't need to pay. I got one question over here.
So she was going to say, pay somebody.
Another thing, you don't need to pay anybody to apply for veterans benefits.
No.
There are people, they have to be certified by the VA to apply for those benefits, but you should not be charged, ever.
Okay, so adding a little caveat to housing, dual diagnosis, both developmentally disabled as well as mental health, and then adding felony charges.
Correct.
Because they were given the opportunity to make their decisions, but they made very bad decisions.
We have a large I should not say large, well, pretty many, 10, 15 individuals we have at Murray that actually have felony charges against them because they were allowed to make those decisions or the police didn't know what to do.
Charges, or are they like out of, they've served their time?
No,
Okay.
some have, well, that's a long convoluted story. And we often have police that don't know how to deal with individuals. And then, or we have individuals who got suckered into being a part of a crime that didn't know what they were doing because they were allowed to make, that is.
I'm going to give you a very quick example. I had a gentleman that worked for me. His son was in, we were living in Decatur, his son was in all the group activities with my son. His son, who was a few years older, was having consensual sex with another person, both of them disabled. The parents of the young lady went after him, saying he took advantage of her, all the rest of it. The police bullied them into taking a plea deal so he wouldn't go to jail, which he never would have. Both mom and dad had a little bit lower IQs, so he wound up taking the plea deal, becoming a registered sex offender.
That's the
biggest issue. And then as they get older,
yes,
especially when a residential placement comes, it becomes very difficult because, you know, like Clinton Manor was a background test on
certain distances of certain
things.
places.
So it is so important, to, especially if the police become involved in anything, to make sure you have an attorney that knows what you're doing. Because Fred is this great guy who has this following him through his life because he was having consensual sex.
It's really a tough.
And it's something we as parents forget. Our children have the right to have sex. And if they live in any facility, any home, they legally are required, if they want to, if the resident or person asks, they're legally required to try to help them figure out how to do it. Okay? So, but as much as we all would like to ignore the fact, it's not the case.
I would add, if it's a past conviction that's causing an issue, there are certain crimes in Illinois that can be expunged. So your record is like it never happened. Land of Lincoln does expungement clinics. You do have to sign up for them, but there can be ways to get rid of that.
And I would just like to say one thing before we go.
I think we have one more.
I'm sorry.
Did you have another question?
I was just going to say, we went to a Veterans Assistance Commission in St. Clair County down in Belleville, and he was very helpful. And because I did go to this one, because Social Security's right next door, which I didn't know. And they were like,
we don't do that.
So I have referred people to this person group, and they have helped a lot, so.
Thank you.
I just had one thing to say. It is very difficult when you have to have to place your child somewhere else. The hardest thing I've ever done for Mark. It broke my husband's heart and mine, but it is the absolute best thing we did for him. His life is so much happier. He has so much more freedom. He sees so many more people. There's so many more people that love him and care about him. And something that I often deal with parents, especially people who just, their children have just moved to Murray or to a CILA, whatever. When your child lived at home, it was not perfect. When Mark lived at home, I promise you it wasn't perfect. When you have a disabled child, their life at home is not perfect. When they move into some kind of placement, it's not going to be perfect. Life is not perfect. And no matter where they live, you want to make it the absolute best as possible. But it is never going to be perfect because life is not like that. Things are going to happen, but that is why you need parents and guardians. You need all that involvement to have their life be the best it can be wherever they're at. And I think you just have to always keep that in the back of your mind. Was his life perfect at home? Did I jump up every time Mark was wet and change him? Absolutely not. I had 2 other kids running around. You know, at Murray, I may go sometime and he's wearing a shirt that I think it looks kind of crummy. But at home, was he always immaculately dressed? Absolutely not. Of course not. He was a kid. And I think you need to work with these people to make it better all the time. And keep making it better and keep advocating for them. And I really appreciate you being here.
Right. And I want to give you one really quick example because it just happened. We had a med mistake, which is called a med error, where my son lives. We wound up in the ER. they did, even though we had the med mistake, they did everything right. This could have been a fatal accident, and it wasn't. By the time we got to the ER, he still was not in life risking danger because they did everything right. When the accident happened, I happened to be there right behind it, so that helped. When public health came in, because I was able to explain to them what had happened, they were able to talk to my son. Because I was an involved parent and I knew what was going on, I was able to help prevent them getting the worst tag that they could give them. There are so many reasons it's important that we understand the environment that our kids are living in, and what can we do to make it better. You know, I take pride in telling people my son lives in a 5-star home, and we were very lucky because the state had to talk to me after the accident. The Clinton Manor had to report it because they did everything right and did it by the book. They did not get this tag that could have been detrimental. And my son's alive. He was never in immediate danger because they did it right. So, and I'll be the first to tell you, I was awful probably the first 3 years he lived there. But I love them with all my heart, and I wouldn't trade where he is for anything. It's the only reason I still live in the state of Illinois.
And I have cards if anyone wants to take
Yeah, I was going to say, so before we all leave, I want to thank Tracy and Carrie and Rita for joining us today. Just a couple of things that are upcoming. This is the first of a series of speaking events we're going to be having. The next one will be May 13th. And it's going to be getting your affairs in order, so it's a more legal, what you need. May 27th will be Senior Medicare Patrol and Fraud, presented by our own Missy Schmidtke. June 10th will be Medicare 101, presented by myself. Medicare 101 is not just for people who are on Medicare. These are people getting ready to start Medicare, people thinking about Medicare in the next 5 years. If you have an older adult in your life who is on Medicare, this is information that anybody needs to know. And then our last event in the series is going to be on June 24th. It's going to be on Veterans Benefits. And we have Brad Leviti from the Madison County Veterans Assistance Commission coming down to speak to us about that. Next thing is we have caregiver specialists. We've already heard about Robin. We have our two other caregiver specialists here also, Jane Young and Nancy Berry.
Let's go, Bubba.
Robin hosts a caregiver coffee talk the first Wednesday of the month from 9 to 10 at the Coffee House Company. And then on the third Wednesday of the month, she has started one at POR on East Main in Belleville, also from 9 to 10:30. But we also have St. John's Community Care in Collinsville that is also doing caregiver coffee talks. On Mondays from 9 to 10:30, they're at Verona Coffee Company in Collinsville. And then on Fridays from 10 to 11:30, they're at Jan's Natural Coffee Shop in Maryville. So you're welcome. It's drop-in. You don't have to do an RSVP for these coffee talks. Yes, ma'am.
Do you have a list of all those dates that you could email us? Oh, yeah.
So we got them. We got them. Then please again make sure if you didn't sign in on your way in, sign in on your way out.
I will make sure that they have our slides, especially since we kind of skipped through. They're going to post the recording on their YouTube channel, and hopefully can you post the slides with that on your YouTube?
And then send it to me.
Right. So they'll have the slides. We'll all have copies too, so we can send them to you. Please do not hesitate to reach out to us.
No, we get
we do this. We do this because we love what we're doing. Because trust me, no one's paying us. Okay, Rita and I just really are doing this because we love what we're doing.
VHS, I'm going to send them a bill.
And also Tracy's got a bunch of Social Security
information up here. You can take these. These are official publications from the Social Security Administration. Take what you want.